Nearly 14 million adults are unable to access NHS dentistry in England. 14 million? Just think about that. It's well over 1 in 4 of England's adult population. That's according to the GP Patient Survey 2025. And analysis by the British Dental Association shows that within this, some 5.9 million people have given up trying. It suggests an increase of 550,000 people giving up when compared to 2024. For millions across England, NHS dentistry has now effectively ceased to exist.
In the past few weeks, I've spoken to 5 people from my rural constituency of North Devon who have been forced to remove their own teeth with pliers or with amateur surgical kits bought online because they are unable to find an NHS dentist.
It's absolutely shocking. This is what then Shadow Health Secretary Wes Streeting said in February 2024.
Unless you reform the NHS dentistry contract and make NHS dentistry pay for dentistry, we're going to see more and more queues like this across the country.
The Labour Party went into the 2024 general election promising to reform the now discredited NHS contract, which it accepted was fueling the current crisis. A year in government and now Health Secretary, Mr Streeting says this.
A year ago, the government said reforming the pay contract for NHS dentists would help. So during a visit to Bedfordshire, we asked the Health Secretary why it hadn't happened.
I'm hesitant to kind of make specific promises about dates and deadlines because unless I'm 100% certain I can achieve the promise, I don't make it, because if there's one thing in even shorter supply than dentists and money in our country at the moment, it's trust in politicians.
People are being forced to pull out their own teeth with pliers. That's not even Victorian, it's medieval. And many are driving hundreds of miles for treatment. And that's if they can find a dentist at all. The dental contract was recently highlighted by the Public Accounts Committee as one of the main reasons for the NHS dentistry crisis. As to the timing of the reform of the now discredited NHS contract, in evidence to the Health and Social Care Committee last week, the Minister for Care, Stephen Kinnock, said this.
We are absolutely clear that we have to fix this before the end of this Parliament.
The Care Minister, however, warned we should assume there would be no increase in the service's budget, which has been cut by over 1/3 in real terms since 2010.
I think we've got to define what we want to do with the NHS contract based on the reality of the finite resource that we will have. We're of course going through negotiations now, as I've said, about that financial envelope. But we have to work on the assumption that we will have a financial envelope that is in the region of the current financial envelope. That is the reality of the world that we live in.
With nearly 14 million adults unable to access NHS dentistry in England, that doesn't sound very promising.
We have to cut our cloth based on the resources that we have. I think if we go into the discussion about the fundamental contract reform with unrealistic expectations about what can be achieved, that would just be the wrong way to do it. So I think we need to be very clear and robust about, with the finite resources we have, this is what we can achieve.
Just to paraphrase, you think that, I don't feel like you're saying we're treating this like a burning platform. You're saying we're treating this like a burning platform within the resources that we have, and we've only got buckets and water.
Meanwhile, the state of NHS dentistry is growing ever more desperate.
The dental crisis has turned a dark corner.
Their website was quite a believable website.
With NHS appointments getting harder and harder to find, unscrupulous scammers are targeting people desperate for treatment.
Criminals are now seeing an opportunity, targeting millions of desperate people with no options.
I've spoken to patients on a regular basis, some of whom have taken their own teeth out, and I know how desperate people are. And this is really, really worrying that people are taking advantage of that desperation.
The situation is appalling, and for some elderly people, not getting dental care can be fatal.
Good oral health is very relevant to, general health. And sadly, we've got,
elderly people in care homes who've got dental problems that really are shortening their lifespan because they can't, have an appropriate diet. They're getting infections in their mouth, which is leading on to more complications. This is not just simply about teeth. This is about the health of the nation.
The government has promised to fix the contract that's fueling this crisis, but says we shouldn't expect any new funding. So what will that mean for the millions unable to access care? Is it rationing or is it means testing? Is it turning dentistry into an A&E service just for getting people out of pain rather than trying to keep them healthy? It would be a grim first for the NHS. Remember, tooth decay, which is almost entirely preventable, is still the #1 reason for hospital admissions amongst young children. The government has said it wants to make the shift from sickness to prevention. There couldn't be a better place to deliver on that promise than NHS dentistry.